Sadness can be a difficult emotion to deal with, not only due to the pain it causes, but also because of the factors that caused the sadness in the first place. Sadness can be the result of loss, helplessness, or disappointment, among many other things. It is important to remember that sadness is one of the most common and natural human emotions and is something that will ultimately help us appreciate our happy times. Sometimes, it is possible for sadness to deepen, and this may be a sign that you are suffering from a form of depression. If you feel as though you are increasingly sad and feel like your sadness is difficult to explain, this video on depression may help. What is depression? Depression is a disorder that is evidenced by excessive sadness, loss of interest in enjoyable things, and low motivation. It is normal to experience feelings of sadness and despair in response to adverse life events. Such events could include loss, major life changes, stress, or disappointment. In most cases, the sad feelings resolve as you come to terms with the changes in your life. In situations such as bereavement, these feelings may persist for months and return at significant times, such as birthdays and anniversaries, related to the lost loved one, provided you have times when you can enjoy things. However, this sadness is not a sign of depression. Depression is common. 1 in 3 people will experience a major depressive episode at some stage in their lives. While most cases of depression are mild, about 1 person in 10 will have a moderate or severe episode. What are the signs of depression? The features of depression can be divided into 2 sections. Let's first consider psychological symptoms. Feeling miserable. This misery is present for much of the day, but may vary in its intensity. The misery lasts for weeks. Loss of interest or pleasure in usual activities. Lack of focus. Slowed or inefficient thinking with poor concentration, leading to difficulty sorting out problems or making plans or decisions. Recurring unpleasant thoughts, particularly about being guilty, being a bad and unworthy person, thoughts that you would be better off dead or of harming yourself in some way. Now let's take a look at physical symptoms. Health concerns. Loss of appetite with excessive loss of weight. Loss of energy, even when not physically active. Loss of interest in physical intimacy or sex due to overcrowding of unpleasant thoughts. Loss of sleep despite feeling exhausted. Sleep is typically restless and unsatisfying with early morning wakening, 1 to 2 hours earlier than usual. Some people, however, may actually sleep a lot more than usual. Slowed activity in speech. Any of these features may serve as warning signs of depression. What causes depression? No one knows exactly what causes depression. It is clear that genetic factors are important in many cases of depression. Depression seems to run in families, as do other mood disorders, and about 30% of the predisposition for depression is due to genetic influences. Stressful life events play a part in the onset or relapse of depression. Ongoing conflicts with others can take their toll on our well-being, as can other social and environmental stressors, such as financial difficulties, retirement, unemployment, childbirth, loneliness, or loss of someone or something important. In vulnerable people, these unpleasant life events may be enough to cause or worsen a depressive illness. A person's personality characteristics are an important factor. When people are depressed, they usually have a very negative view of themselves and the world. They do not appreciate good things, and bad things seem overwhelming. Some people have a tendency to view things this way even when they are not depressed. In other words, they may have a depressive personality style. Another possible cause of depression that should not be overlooked is physical illness or medications. Glandular fever, influenza, hepatitis, thyroid hormones, anemia, diabetes, birth control pills, alcohol and other substances of abuse, or other medications, such as those for heart or blood pressure, may all cause symptoms of depression.
Yesterday is history. Tomorrow is a mystery, but today is a gift. That is why it is called the present. With